Okay. Good evening, ladies and gentlemen. My name is Judith, and I will be your facilitator for this workshop this evening. First of all, I would like to say thank you for your precious time. Thank you for your willingness to learn more about the COVID-19. As you all know, since 2020, we have our normal life has been changed, and from the questionnaire that we have distributed to you, and from your responses, we have noticed that there is a lack of knowledge about the COVID-19. It is true that it is an ongoing situation, but there are a lot of speculations from people. They do not know the origin of the COVID-19, the symptoms of the COVID-19, what to do when you get COVID-19. So this workshop has been designed with reliable sources to educate you more about the COVID-19. So without further ado, let's start. This workshop is more based on to answer all questions regarding COVID-19, such as where did it start, how did it start, and how to recognize the COVID-19. So we'll start by asking ourselves, what is COVID-19? COVID-19 is coronaviruses are a group of viruses belonging to the family of Coronaviridae, which infect both animals and humans. So basically, COVID-19 comes from animals, more specifically from bats. And human coronaviruses can cause mild disease like a common cold, while others cause more severe disease, such as MERS from Middle East Respiratory Syndrome, and SARS, Severe Acute Respiratory Syndrome. A new coronavirus has previously not been identified in humans, emerged in Wuhan, China in December 2019.
早上就有44例吧，
有
11例重症，没有这么紧张。
哦，
那沙士啊，它那些传染性没有像那样紧张。
那您还是对政府的政策比较放心的是吧？
哎。
It is true that there are lots of speculations and people did not know exactly where the COVID-19 started. Some say it was in the US, but according to the World Health Organization, COVID-19 came from the city of Wuhan in China. Uh-oh. So what about COVID-19 in South Africa? We know that it is a global health issue, but what about it in South Africa? So on the 5th of March 2020, Minister of Health, Zweli Mkhize, had confirmed the spread of the virus to South Africa, with the first known patient being a male citizen who tested positive upon his return from Italy. On 15th March 2020, the president of South Africa, Cyril Ramaphosa, declared a national state of disaster and announced measures such as immediate travel restrictions and the closure of schools from 18th March. And on March 17th, the National Coronavirus Command Council was established to lead the nation's plan to contain the spread and mitigate the negative impact of the coronavirus. So since we all are in South Africa, we are aware of the measures that the Minister of Health and the President of South Africa, Mr. Cyril Ramaphosa, had taken. And from those decisions, health decisions that they have taken, we knew that this situation is severe, and that yeah, these measures were taken to protect the people of South Africa. So it did not stop there. On the 23rd of March, a national lockdown was announced. Starting on the 27th March 2020, the first local death from the disease was reported on 27th March 2020. On 21st April, a 500 billion rand stimulus was announced in response to the pandemic. President Ramaphosa announced that from 1st May 2020, a gradual and phased easing the lockdown restrictions would begin, lowering the national alert level to 4. From 1st June, the national restrictions were lowered to level 3, and finally the restrictions were lowered to level 2 on 17th August 2020. And from 21st September 2020, restrictions were lowered to alert level 1. So we have seen how the president and all the people in power have stewarded this situation, just to show the severity of the virus. So since it is a severe situation, how can the population recognize symptoms or signs that, hey, this is COVID-19? And from the questionnaires we have noticed that most of the responses were expressed uncertainty. People were not sure how to recognize the COVID-19. So from the World Health Organization, we learned that the signs and symptoms include respiratory symptoms and include fever, cough, and shortness of breath. In more severe cases, infection can cause pneumonia, severe acute respiratory syndrome, and sometimes death. But to be more clear on this subject, the less common symptoms are sore throat, headache, aches and pains, diarrhea, a rash on skin, discoloration of fingers or toes, red or irritated eyes. These are less common symptoms, and yes, these are less common symptoms. And the more serious symptoms are difficulty breathing or shortness of breath, loss of speech or mobility or confusion or chest pain. These are very serious. And to get to this stage, it means you are maybe an elderly person, or you previously had health issues, and this COVID-19 is just enhancing your previous illness. So since we know where it started, how it started, and how to recognize it, what should we do to prevent the spread of the COVID-19 so that less and less people are infected? The standard recommendations to prevent the spread of COVID-19 are cleaning of hands, using alcohol-based hand rub or soap and water, covering the nose and mouth with a flexed elbow or disposable tissue when coughing or sneezing. So what basically you should do to stop the spread of the COVID-19 is whatever you feel like coughing, you just do with your elbow. You don't have to openly cough, so that you protect the people who are around you. Next, il me reste 12 minutes. And according again to the World Health Organization, to prevent the spread of COVID-19, you should maintain a safe distance from others, at least 1 meter, even if they don't appear to be sick. So even if a person appears to be very healthy, just for health or for less spread of the COVID-19 sake, we should keep 1 meter from each other. To wear a mask in public, especially indoors, or physical distancing is not possible. I know that it is very difficult to wear masks for 24 hours, but for health reasons, we should wear masks. When our authorities say that we should wear masks, it's not because they want to make us prisoners, but just because they care about us. And doctors and research has proven that when we wear our masks, we actually protect ourselves and we protect the people who are around us.
In our centers, everyone has to wear surgical masks to reduce the spread of COVID-19. This gives 2 levels of protection. First, it blocks droplets that could carry germs from leaving the mask when someone breathes out. Second, if any droplets do leave the person's mask, they are blocked from entering the nose or mouth of other people by the masks they are wearing. The key to all of this working is to wear masks properly. Let's review how to do this. Make sure your mask is tight against your cheeks, tucked under the bottom of your chin, and pinched tightly where it meets your nose. The goal is to make sure there is full contact between the top, bottom, and sides of the mask with your face. No gaps. Gaps can allow droplets that carry germs to leave and enter your nose and mouth. It may feel hot and stuffy, but that means you're doing it right. If you see a gap in someone else's mask, alert a dialysis teammate. Also, the mask must remain in place. This includes not moving the mask to talk, eat, or itch your nose or face. Just like a scuba diver wouldn't remove their mask because water would rush in, we shouldn't remove our surgical masks because germs can come in. The exception is for patients who take an oral medication and only remove their mask for a few seconds. Otherwise, we should keep our masks on in the waiting room, treatment floor, bathroom, and even offices and conference rooms. Don't wear it on your forehead or neck. Keep it in place always. Thank you for doing your part to keep us all protected.
and we stop the spread of the COVID-19. We should also choose open, well-ventilated spaces over closed ones. We should open a window if we are indoors so that we can breathe fresh air. We should clean our hands frequently. We should get vaccinated. It's true that there are lots of speculations surrounding the vaccination, but it is just one way to protect ourselves and protect the lives of our loved ones. Cover your nose and mouth with your bent elbow or a tissue when you cough or sneeze. We have talked about that, and I have shown you an example. So now that we know how the COVID started, where it started, the symptoms, and how to prevent the spread of the COVID-19, now we should look at the main types of transmission. From the questionnaire again, we have noticed that many people are uncertain about the ways in which COVID-19 is transmitted from one person to another. So we have done research from reliable sources, and these are the main types of transmission. First of all, it's from droplets of, je sais pas comment lire ça. Je vais couper cette partie. But COVID-19 is in general airborne. So if you from, yes, it's airborne. Surface transmission. The less common method is when you touch surfaces as well. You can, for example, if a person who has COVID-19 touches a surface and that surface isn't sanitized or cleaned, and then another person touches that surface, they will get COVID-19. Or from yes. So what should one do when they get COVID-19? First of all, if you feel like if you notice all the symptoms that we have just elaborated about COVID-19, first of all, you should call your healthcare provider or COVID-19 hotline to find out where and when to get a test. So before taking any medication, even if you are taking ginger, for example, people are saying that if you take lemon and ginger, it's some sort of self-medication. So before taking all of that, you should first of all call a doctor, your health provider, so that you get a test, and they can tell you what exactly you should do to cure the COVID-19. And secondly, cooperate with contact tracing procedures to stop the spread of the virus. If testing is not available, stay home and away from others for 14 days. While you are in quarantine, do not go to work, to school, or to public places. And lastly, keep at least a 1 meter distance from others, even from your family member. We have already talked about this. Or you should wear a medical mask to protect others, including when you need to seek medical care. So even if you are going to the hospital, you're going to see your doctor, you should wear a medical mask to protect yourself and to protect people around you. We have we have talked about all of this. You should clean your hands frequently, stay in a separate room from other family members. We've talked about all of this, so I assume you are aware of, you are already aware of all this. So what are the available treatments? Let's say an elderly person is infected with a COVID-19 and they had previous illnesses. So what will be the solution? According to research, they have developed some vaccines which are even available in South Africa. There is a Pfizer vaccine, there is a Johnson and Johnson vaccine, and South Africa has already started vaccination since 2021, just after the approval of Pfizer and the Johnson and Johnson vaccine. But according to World Health Organization, the first mass vaccination program started in early December 2020, just a year after COVID has been declared as a pandemic. At least 13 different vaccines across 4 platforms have been administered. Campaigns have started in 206 economies. The Pfizer emergency, okay. So that's it for our workshop. I hope that you now know for sure that COVID-19 has not started in the US or in Africa, but it started in China. And by now, you know the symptoms of COVID-19 and you can recognize them in a person. And you know the preventive measures and what to do when you get COVID-19 and the available treatment of COVID-19. That's it for today. I don't know if you have any questions and you need more clarification. I'm all ears. Is there any question?
No question. It was all clear. Thank you. Thank you for the information.
Yes,
Judith.
Roji, you can unmute yourself and you can ask your question.
Hi everyone. Hi Judith. Hello.
Rudy, I saw that you raised your hand.
Yes, I did. Hello. Apparently. Hello.
Or can you type your question so that I can... No, I cannot hear you. You can maybe type your question. Yeah, waiting on your question. Rudy, is your question still coming? Rudy is saying, in terms of the side effect of the vaccine, have you made more research about it and know what is the most common side effect? The most common side effect is maybe pain in the arm. There are other testimonies where people say they became impotent, they became infertile, but those testimonies have not been verified, and the majority of people who received the vaccine gave positive feedback on the vaccine, but the side effect, we have not dug deep into that. But those are just the available treatment of COVID-19, and on a scale from 1 to 10, there have been, I can say that 80% have been positive. Do you have more questions, or it's now clear? Thank you so much, ladies and gentlemen, for your time this evening. I really appreciate you making time to participate to this workshop. It proves that you want to learn more about the COVID-19, and you take it seriously, and you want to protect your life, and you want to protect the lives of the people around you. Thank you so much, and keep smiling. Thank you.